What is the role of genetics in heart disease?
I mean, it plays a role for sure. I always ask patients, first to just a very good history, tell me about your mom's history and tell me about your mom's mom. I want to know about the mom side first because I care about their maternal haplotype. I care about their mitochondrial DNA first because that is going to be the best sign how well they're going to age. It also gives you an idea of like how well they're going to do with light, cold therapy, keto diets. That's more important. But epigenetics has a big role in turning a lot of these other genes off. And so the four big genes that I always check when there's a family history of people having events in their 40s and 50s, we talked about a little bit earlier, is lipoprotein(a) or Lp(a). Up in 20% of the population may have high levels of Lp(a), which is the number one atherogenic particle that you could inherit. If you have an ApoE4 allele, that increases the risk of vascular disease, Alzheimer's, diabetes, especially if you have two copies of the ApoE4 allele. There's a heart attack gene called 9p21. It mostly affects the endothelial lining and the underlying intima. There's also one called KF6. So those are the big four that I check in almost everybody. But then if they have high blood pressure as well, the Vibrant America has a panel, Cardia X, checks about 25 to 30 different genes that affect blood pressure, looking at different markers that affect, aldosterone levels, renin-angiotensin levels, are you fast or slow metabolizer of caffeine? Those all come into play sometimes for giving people lifestyle interventions. And then if they have, significant lipid issues, then I tend to use a GB Insight panel that looks at about 120 different genes to tell me, okay, why are their lipids abnormal? And then we can kind of talk about different lifestyle, nutraceutical supplements or medications based off of the genetics. So, the genes are important to look at, but it's the same story as like, what is going on with the endothelium? How much oxidative stress inflammation is present? Those are the things that you're really trying to modify.
All right, so it has to be looked at holistically, and people who have a higher risk on the scale, they're high risk on the scale, then you will be more aggressive with them and have more of a heart to heart talk per se, and try to work on their risk factors as much as possible, and you can do what you can do, and mitigate any risk as much as possible. What do you tell people who may be, for example, having hereditary forms of diseases such as, I believe you mentioned
Mm,
apo
right.
E4, right. So you mentioned apo E4, and of course I think that also has a correlation with Alzheimer's disease. And so these type of diseases sort of cluster together. But with regards to heart disease, how much of a larger risk it leads to for an earlier form of heart disease?
For ApoE4 carriers, it's mostly because it affects the lipoprotein metabolism. The patients with ApoE4 tend to have higher levels of the ApoE containing particles. It mostly affects the LDL receptor and the clearance of the ApoE particles. And so that's probably how it mostly has an effect on it. But it also increases the risk of diabetes. And if you're insulin resistant, that's kind of like fuel on the fire that really is going to damage the glycocalyx, and then the dyslipidemia, feeds forward to developing more plaque. So, you get one copy of the ApoE genes from each parent. So, you got to look at that, and then it kind of helps you know, like, okay, what nutrition strategies to focus on this person, or, you know, I'm sure we're going to talk about medications in a moment, but, patients who are an ApoE4 carrier, sometimes the real high dose, um, fat soluble statins, they're going to cause a lot more side effects in those individuals.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umar Khan. Looking forward to seeing you again. Thank you.